The first of the facial bones that we're going to look at is the mandible. It's the largest, strongest bone of the face. It's a U-shaped jawbone made up of a body and two upright rami. You should know the condylar process because it forms part of the temporomandibular joint. And there's also some foramina. Foramina means it's a smaller hole. A foramen is a bit of a larger hole. So there's a mandibular foramen and a mental foramen, which you should know. So again, if I ask you where the mental foramen is, you should be able to tell me that it's on the mandible. So this is a part of a synovial joint that we'll be talking about in the next chapter. But the mandibular condyle or condylar process, as they call it here, is going to fit upwards into a socket called the mandibular fossa of the temporal bone. And if you take a minute and you put your fingers right on your TMJ joint and you lower your jaw and then raise your jaw, you'll feel the condylar process, the mandibular condyle, you can use either term, fitting into the mandibular fossa. Because remember, in the last chapter, I mentioned that oftentimes condyles will fit into fossas. And that is a super common way that a joint is formed all throughout the body. Our next facial bone is the maxilla, or maxillae for plural, and there's two of them. They have the zygomatic process on them, which articulates with the zygomatic bones. So notice the zygomatic process is on the maxilla and not the zygomatic bone. There's also some sinuses there called the maxillary sinuses. If you've been to the doctor with a potential sinus infection, one thing that they may do is with their fingers press on your maxillary sinuses to see if it hurts. Our next group of facial bones includes the zygomatic bones, which forms the cheekbone. It articulates with the zygomatic process of the temporal bone, the frontal and maxillary bones. The nasal bone, which forms the bridge of the nose, articulates with the frontal, maxillary, and ethmoid bones. The lacrimal bones articulates with the frontal, maxillary, and ethmoid bones. And it has a little bit of a depression called the lacrimal fossa, which houses the lacrimal sac, something that we'll be learning about at the very end of the semester. The next facial bone would be the palatine bone. It has the perpendicular plate, which forms the posterior lateral wall of the nasal cavity. And then the vomer bone, which forms part of the nasal septum. So if you imagine the center of your nose where it is, a lot of people get nose rings there. Posterior to that would be the vomer bone. Then there's the inferior nasal conchae. They form the lateral walls of the nasal cavity, and it's the largest of three pairs of conchae. So the ethmoid bone forms other two pairs. So we see the ethmoid bone here, the inferior nasal concha, the nasal bone, maxillary bone, palatine bone, and sphenoid bone. We can see on this image the superior, middle, and inferior meatuses, the frontal sinus for the frontal bone. Within the ethmoid bone, we have the superior nasal concha and middle nasal concha. And the maxillary bone has the palatine process. The palatine bone also has the perpendicular plate. And in the sphenoid bone, we have another sinus. So again, you need to remember that there are four pairs of sinuses. And we'll see that in a slide coming up. The next bone is not a bone of the skull. It's called the hyoid bone. It lies in the anterior neck inferior to the mandible, so you can't palpate it unless you are almost to choke yourself, so please don't do that. It's the only bone in the body that does not articulate directly with another bone, so it's anchored by ligaments. And it acts as a movable base for the tongue and site for attachment for muscles of swallowing and speech. So one time when they know this bone is breaking, for example, if a medical examiner discovers that this bone is breaking, it's possible that there was a suicide or a hanging that had occurred. So let's look a little closer at the orbits. The orbits are the cavities that encase the eyes and lacrimal glands, which would be the tear ducts essentially. It's attachment for eye muscles, which you'll learn about later in the semester. And there's actually 7 bones that make up the orbit: frontal bone, sphenoid bone, zygomatic, maxilla, palatine, lacrimal, and ethmoid. So we can see a lot of these bones shown around the orbit. For our special characteristics of the orbits and nasal cavities, the roof is the cribriform plate of the ethmoid. So again, you should know that's part of the ethmoid, as well as the crista galli. The lateral walls are the superior and middle conchae of the ethmoid, perpendicular plate of the palatine, and inferior nasal concha, which is a separate bone. The spaces between the concha are called meatuses, which I pointed out on the previous slides. And what the conchae do is they increase the turbulence of the airflow. The nasal septum is the bony posterior formed by the vomer and perpendicular plate of the ethmoid. Anterior to that is the septal cartilage, which you can feel when you compress your nose. So some other important parts of this diagram are, of course, the frontal sinus of the frontal bone, nasal bone, perpendicular plate of ethmoid bone, vomer, the palatine bone, sphenoidal sinus, and sella turcica. The sinuses are shown on this slide. So as I mentioned, there are 4 pairs of sinuses. Paranasal sinuses are formed from these bones: the frontal bone, sphenoid bone, ethmoid, and the maxillary bones. All sinuses are mucosal lined, air-filled spaces, and their functions are to warm and humidify the air. They help to lighten the skull because they are a cavity within the bone that lightens those specific bones, and it enhances the resonance of the voice. So you all know when you or somebody else has experienced a sinus infection, oftentimes their voice can change. So when we look at an anterior view at the top here, we see the frontal sinus. The ethmoid and sphenal sinuses are just superior to the nose. And then there's the maxillary sinus. When we look at a lateral view, we see, or the medial aspect, we see the frontal sinus, ethmoid, sphenoid, and maxillary sinus.